It's been a while. I've been meaning to make this video for several weeks now, and I just keep putting it off. I've been working, going through chemotherapy. Give me a break. But I do want to make this video about chemotherapy, what it has been like for me, what you can expect if you're about to start it. So my chemotherapy regimen is 12 weeks of Taxol, and then during the 12 weeks, every 3 weeks, I get also carboplatin and Keytruda. Keytruda is an immunotherapy, and so that's something that's just out of clinical trials for triple-negative breast cancer. They had a lot of success with adding immunotherapy to this chemo regimen in order to get a better response. So I am at 7 weeks into the 12 weeks of Taxol. And after these 12 weeks, then I switch over to AC, which is also called the Red Devil. And I'm nervous about that because that's supposed to be pretty hard chemo drugs. And the A stands for Adria, the C is Cytoxan, I believe. And I'll be getting that every 3 weeks for 4 cycles. And I'm also still going to be doing the Keytruda, the immunotherapy through that. Then surgery, then 24 more weeks of Keytruda every 3 weeks. One thing you should do before going to your first chemo appointment is to do some Googling, join some groups, talk to some people who've been through it before, and see if they have any tips or tricks. One thing I learned from a support group the day before I started chemo was with Taxol, one of the biggest side effects is neuropathy in your fingers and toes. So it's like this tingling, numbness in your fingers and toes, and once you get it, it might not go away after chemo, it might be permanent. Really didn't want that to happen. And I learned that if you ice your hands and feet during the Taxol infusion, you're much less likely to get that side effect. So I found some footies that are specifically made for that and some mittens on Amazon. And those I've been using every time I go, just for an hour. I have to sit there with my hands and feet on ice. It's uncomfortable, but it's worth it if it keeps me from getting this side effect that could last potentially for a long time. And that's another thing to be ready for. If you do have to do something like that, ice your hands and feet, have something to keep you occupied so you're not just staring out the window. My first appointment, I didn't have anything planned, couldn't use my hands, couldn't really use my iPad that I brought, so I was just staring out the window. It was boring for an hour. But once I knew to be prepared for that, I downloaded some shows and I would just watch House while I was icing my hands and feet. The first time I went in for chemo, I was really nervous. I didn't know what to expect. I was afraid they would hook me up and then I would start feeling really sick right away. I would throw up all over the place. I didn't know what to expect, even though reading online, everybody said, it's just boring, you just sit there. I was nervous, and because of the pandemic, I couldn't bring anybody with me. Not that I have anybody to bring anyway, but I had to go it alone. I did get a friend from work to drive me to the first appointment, and then all the subsequent appointments, I've had a good friend volunteer to take me to all of them, which is so nice because I know it's a big hike. It's quite a drive. Anyway, the first appointment, I go in and I have my list of questions. I'm really nervous and I'm asking them all to the nurse that's hooking up to my port. And she doesn't know the answers to some of them because they're specifically questions for the doctor, but she answered them all the best she could. And then I did get to meet with the doctor that day. I don't get to meet with him every time I go because I go weekly. I only meet with him every 3 weeks. The first thing that they do is take your temperature. Well, I think that's because of COVID. As soon as you walk in, you have to be wearing a mask, and then they take your temperature, ask you if you've had any symptoms, that whole rigmarole. And then they took me into this big room with all these chairs and said, pick a chair. Well, first they weighed me, and then I got to pick a chair. So I picked one by this window. There's a big window, so I could just stare outside. Then a nurse came up with a cart and she hooked up to my port. So an hour before you go, you're supposed to put this lidocaine on your port so that it numbs the skin so you don't feel anything. The first time I did it, I didn't put enough on. I did feel like a slight pinch, and then when they took it out at the end, I felt that a little bit. And the nurse told me to just put more. So you put like a big goober on the port, and then you put a cling wrap over it. So just a little square of cling wrap and a big goober of lidocaine right over the bumpy part of the port, and you don't feel a thing. Let's talk about pre-meds. Before they give you the goods, they have to give you some pre-meds. Depending on what chemo drugs you're taking, these will be different. For me, it was Benadryl. An IV drip of Benadryl is not like a pill Benadryl. It's very different and it makes you very high. I call it Benadryl baked. And then there's also a steroid. The steroid makes me really hungry for days and it keeps me up the night after the infusions. So usually I don't sleep well on infusion day, but it makes me have a good appetite, gives me energy the day after. I'm like super energetic the day after an infusion. Time out. Infusion. The first time I walked in for my first chemo appointment, they asked me if I was there for an infusion, which sounds like some sort of spa treatment. So I had to look around like, wait a minute, I'm here for chemo. They're like, yes, the infusion. So be ready for that. Anyway, pre-meds. Benadryl, steroids, Pepcid for your stomach, and then Zofran, which is anti-nausea medication. And so far, knock on wood, I have not had any nausea, which I consider myself very lucky. I think once I switch to the Red Devil, I might be telling a different story. But so far, I haven't had any of that, and that's what I was most worried about. I've had a good appetite. I've been able to keep eating normally, probably eating more than normal throughout the chemo so far. So after they give you the pre-meds, then they switch over to the meds you came for, the Taxol and the Keytruda and the carboplatin for me. And all they do is switch out the bag, so you can just sit there reading. I like to do this app on my iPad. It's a coloring app, so it's just really brainless. I just push the buttons, especially once I get that Benadryl in me. Like I can't read a book because I can't really concentrate. I'm all, I can't even follow along on some TV shows. I was downloading some shows off of Prime and trying to watch those on my iPad, and I was like, I don't even know what's happening. I don't know who these people are. I found that I started downloading old episodes of House because I've probably seen it before and it kind of follows the same formula, so it's very easy to know what's happening and follow along. And I found that works well when I'm on the Benadryl. After that, another drug that they put me on is called Zoladex, and I get this every 4 weeks, and instead of being an infusion, it's just a shot in the belly. So it's real uncomfortable, and it's a shot, and it's this little like bubble thing that they inject into you. So shot, and then you have this little bump on your stomach. It's very unpleasant, kind of hurts, but I did learn a new tip for that, to put the lidocaine cream on my stomach in one area where I'm going to get the shot before I go in for those appointments. So I've had 2 of them so far, and I didn't know about this tip beforehand, so I was just kind of bearing it, but I'm gonna do that next time for sure. I love getting good tips. Let's talk about side effects. I can't talk about AC side effects because I haven't taken that yet, and the side effects I experience most likely won't be the same for you. Everybody reacts differently, so don't listen too much to other people's experiences because you'll probably have a different one. For me, I guess I'll just start going through the list. The first thing that happened was the day after my very first infusion, my face just turned red. Early in the morning, I was drinking coffee, which I wasn't sure if I was supposed to be doing, but I did it anyway. And it's just my whole face got flushed, and my chest and my neck, and it lasted all day. And I kept taking my temperature, but it was normal. So that went away after a day, luckily, and hasn't happened again. Another side effect that's been pretty consistent was constipation and diarrhea. Gross, I know, but be prepared for it. So even though it might not happen to you, get some Imodium, get some stool softener beforehand just so you have it, just in case. I have had to use the Imodium a couple times, but it's starting to even out a little bit, starting to get a little better, so moving on. I've also had fatigue. been very tired sometimes, not all the time. It kind of goes in cycles. So when I get the infusion with all 3 of the drugs, for about 4 days after that, I'll be super beat, sleeping 12 hours a day, just really tired. But I do have bursts of energy in between. So it's not like I'm just in bed 24 hours. I sleep a long time and then I can still get up, I can walk the dog, I can do laundry, but I'm probably not gonna be going to any parties anytime soon. But it does get better. So whenever you're having those down days where you just feel really tired or really sick, just remember that it's not gonna last forever and it will get better. Other side effects, bloody nose. So not like gushing bloody, but every morning when I wake up and I go to blow my nose, it's bloody. So I got some nasal spray, like saline nasal spray, and then Vaseline. I'll take a Q-tip and put Vaseline on the inside of my nostrils to help. Bloody gums. If I'm brushing my teeth, I might get bloody gums, so I switched to an extra soft toothbrush, and I also use Biotine mouthwash because I also get dry mouth. I've had some mouth, like tongue sores, little sores on my tongue, and sometimes my tongue has felt swollen, which is really uncomfortable. So they prescribed me this magic mouthwash, which I don't know what's in it. It's some sort of mixture that only some pharmacies will make for you, but it numbs your whole mouth and it helps to get rid of those sores. And it definitely helped, but it was expensive. Other side effects I've had include headaches. I've had some sinus headaches, which I think is also because of the drying out of your sinuses. But those have come and gone. There's the hair loss, which you can see. There's, what else? There's a long list. It's a lot of things that on their own aren't so bad, but once you put them all together, it gets pretty exhausting. It just, like, really? Another thing. But I'm hanging in there. I just finished my 7th out of 12 Taxols, and as we've been going along, I'm able to feel the tumor. It's pretty big. When we started, it was 7 centimeters, and I noticed that it's not shrinking. I was waiting and waiting and hoping, but it wasn't shrinking, and I would still have days where it would start to hurt. Like I'd get this really sharp pain, and I kind of think of it as growing pains in my head, so it felt like it was growing. Told my doctor about it. He waited until we had done 2 full cycles of the Taxol, which is 6 weeks, and then we got an MRI. I just got the MRI results today, and unfortunately the tumor has grown a little bit. It has not shrunk, but it also has not spread to the lymph nodes, so that's a positive. My doctor's on vacation this week, of course, timing. So once he gets back, I'm gonna talk to him about what we're gonna do next. We might switch up the drugs. I don't know what's gonna happen, but that's kind of disappointing news. I was really hoping it would shrink. With triple negative breast cancers, I guess sometimes they can be really responsive to chemotherapy, but a lot of times they don't respond at all. So, boo. We'll see. I'll keep you posted on what happens next. Thanks.